Resilience is our ability to be able to keep going even when the going gets tough, when things are going wrong, when we're finding things difficult. It's our ability to be able to navigate those difficulties, to learn from mistakes and to keep on with the journey. We need to be resilient because what we need to do is to be able to model that to our children and young people so that they can also develop their own resiliency. So that means being reflective, thinking about your behaviours, thinking about your interactions and thinking about what you've learned when things have gone wrong so that you can go back, process that and think, what would I do differently next time? Key elements of education are to build hope and optimism in our children and young people and in ourselves. And there are two kind of prongs to this in essence. The one is that we educate the children and we educate them to be more resilient, to be more self-accepting, to be able to build their own self-esteem through their interactions with us. But the other element is that we educate ourselves. We educate ourselves about the child, what their needs are, what we can do to help and support them. But also we educate ourselves in the best ways possible to interact with them effectively. It really is something that belongs to us as individuals that we need to take responsibility for ensuring that we remain educated, we engage in lifelong learning, particularly if we want to be better at doing what we do, but also that we educate ourselves about our children and young people, what their needs are and how we can best meet them. Acceptance is about us really accepting ourselves for who we are, understanding who we are and knowing our strengths, our weaknesses, and also understanding the child in exactly the same way, who they are, what their strengths are, what their weaknesses are, how we can help to build and nurture their self-esteem in particular. We can't expect children and young people to be something else before they're ready. We need to go with them on that journey. And part of that is showing them as well how we accept them, we nurture them, we show them this unconditional regard, and that's vital. Healing happens through positive relationships. Child-centred is about making sure that the child becomes the centre of all that we do, that all of our interactions, all of our planning, all of our systems around that child are really centred on ensuring that they can be the best that they can be and that we give them the opportunity to develop the skills that they need. It's about them, it's not about us in the first instance. If I'm going to be child-centred, then I have to understand how to support the child to develop their own emotional literacy skills, help them to self-soothe, to co-regulate with them, to help them to understand their feelings and their emotions and their behaviours. Should be our primary focus, to put them first, to be emotionally literate enough ourselves to be able to support them in developing their own skills. Being holistic when we're looking after our children and young people is about ensuring that they feel connected to all the different contexts that they find themselves in. So that would be their birth family, their foster family, outside in the local community, within the educational context. It's really important that we give them this sense of safety, this secure, safe base, that they belong to all of those and that they understand and know how to navigate them appropriately. They feel safe within each of those contexts. We ensure a level of consistency so that the child feels safe and nurtured. Being holistic is essential for the overall well-being of our children and young people.